Before Texas Stroke Institute, we were able to treat those patients, but at a very primary level.
In the 1990s, we didn't have too many specific therapies for brain attacks. We had aspirin and some cardiovascular risk factor management strategies.
This year in the United States, almost 800,000 people will experience a stroke. That's about 1 every 40 seconds.
Just like in a heart attack where time is muscle, time is also brain matter as neurons in a stroke.
So the Texas Stroke Institute is a collaborative initiative that goes beyond one hospital or one doctor and includes multiple facilities so that they communicate and connect to each other.
We've worked with our hospitalists, worked with our medical staffs, worked with our emergency department physicians, technical staff, and so forth, and really have standardized.
Not every stroke hospital delivers all facets of stroke care. So it requires a system.
I'm talking the same language that you're talking, whether it's in Palo Pinto or Dallas, Fort Worth, wherever that is, we're talking the same language, we're using the same scores, we're utilizing the same treatment algorithms and therapeutic interventions. We're just on the same page. That's better for the patient.
We at the Texas Stroke Institute are very committed to increasing IV-TPA treatment rates, and we feel that empowering EMS and ER to have streamlined processes, algorithms, and triaging systems will significantly help accelerate the usage as well as effective delivery of TPA for patients with brain attacks.
The LEG score is a unique tool. It's an abbreviated NIH stroke score. We use it, the paramedics use it in the field to help us determine the best destination for the patients. What it does is it pares down that full NIH stroke score to give you the most important information you need in order to get them to the correct location and destination.
Telestroke is an initiative that assists physicians through a robotic presence. They actually interact with the physician. It has the ability to zoom in. It can zero in on the pupil size. It can actually test gazes. Telehealth also allows us to be able to differentiate those patients who need an additional level of care. So we can determine whether the patient is a candidate for IV TPA and then maybe take care of them where they're at in most cases. In those rare cases, about 20% of the time, those patients will need a higher level of care. And that includes being coordinated with our one-call transfer center.
Well, the transfer center is staffed with RNs, EMTs, and paramedics 24 hours a day. In many places, you have to make multiple phone calls to multiple physicians, to multiple hospitals. The transfer center can assist the sending hospitals with obtaining a ground ambulance to transfer the patient. We can also assist with obtaining a helicopter to move the patient as quickly as possible. The fact that we have access to the neurologist instantly, we have not only their answering service, we have their cell phone numbers, we know where they are at all times because of a computer system that we use. We're able to access them quickly and move the patient very, very quickly from one level of care to the next. One call gets you all of those services.
Right now, we have newer and newer therapies which can further treat patients with brain attacks with catheter-based minimally invasive therapies to pull out blood clots, to kind of coil brain aneurysms, to place stents and open up blocked blood vessels in the neck, and several other therapies that are newer and more technologies are coming around every day.
We have a phenomenal opportunity to educate our physicians, our local hospitals, our community hospitals, the general public.
We really want to help your facility, your town, develop your stroke center and improve the quality of care for your stroke patients.
We give them order sets, protocols, standardization, treatment, guidelines that they're able to adopt readily.
And we have courses for your administration, courses for your educators, courses for your stroke coordinator.
We also hold educational events for the general community to come and learn about stroke. We have some phenomenal neurosurgeons that are very well trained and very well spoken.
So together, we function as a network, and it's helping keep the patients in your community, out in the community hospitals, smaller hospitals, and let you care for those patients when and if you need TSI. Transfer in. We're going to help guide you through that process.
Texas Stroke Institute not only is a system of care that gets the patient to the right facility, it's also a system that helps facilities in their own communities drive their algorithms, their protocols, help their communities understand why they need to dial 911, and keep patients in their communities.
There's the opportunity to deliver care within their facility and retain patients closer to home, which means a great deal to that hospital's growth, but it also means a great deal to patients.
In addition, it's access to advanced therapeutic interventions for those patients who may benefit from it.
We make a difference in North Texas.
We provide the highest level of physician expertise.
We're making miracles happen.
We educate, we work together, we save lives.